Okay, so this is part two. This is our arthritis talk. So just like Resnick uses a targeted approach for understanding arthritis at the view box, Prometheus Lionheart uses a target approach to understanding arthritis for the purpose of multiple choice. So what I've got here are three cartoons of the hand, and the black things are where this particular form of arthritis tends to target the most. The middle one you'll notice has some gray stuff, so there's like sometimes that targets it, and if it's white or if it's not, doesn't have a star on it, then you don't typically see arthritis there. So let's look at this first one. So pretty much all the IP joints, and then this first CMC and triskaphy. So that's something you say all the time, right? That's a classic for osteoarthritis. This one here is more proximal. It's a buzzword, or a way to think about it is, it's the most proximal joint here, where the finger meets the hand, and it's the carpal bones, right? So like really here, like pancarpal joint space loss, symmetric joint space loss, that's rheumatoid arthritis. And then we've got another thing that's very common, and this is the spot right here I want you to think about right here. Metacarpal phalangeal joint, all the way across here. This is cppd, okay? So if you're going to remember anything, I would just remember this and the fingers, OA, this right here, RA, and this right here, cppd. All right, same deal. This is the tip of a finger here. This is it could be any IP joint. I'm showing it as the tip of the finger, but it doesn't have to be a DIP joint. It could be in any IP joint. But the point of the case is to show asymmetric joint space narrowing, symmetric joint space narrowing with erosions, periosteal reaction along the outside here. So let's do this first one here. What I'm showing is there's asymmetric joint space narrowing. There's some osteophytes and some debris. There's a little cystic thing here. Might call that a geode. So it's classic for OA, right? Asymmetric joint space narrowing, osteophyte. So if you were asked to you've been hired by the local high school, osteoarthritis high school, and osteoarthritis high school needs a mascot, and you can only choose. You're gonna choose the mascot for the high school. What are you gonna pick? So when I ask people this, they usually say an osteophyte. So when you say osteoarthritis, I say osteophyte. So if you're seeing osteophytes, you should be thinking osteoarthritis. The next thing is erosive OA, and this is this so-called gull wing deformity. That's a central erosion right here. That's classic for erosive OA. Erosive OA is a little bit different than regular OA. One, in that it's erosive, and two, it tends to affect an older population. The next one here is symmetric joint space narrowing. So where this was sort of asymmetric from wear and tear, think about this as all this caustic enzymes are sort of poured in here, and they layer symmetrically, so you have symmetric joint space loss, and that's rheumatoid arthritis. Notice also that there's no bony proliferation. That's an important thing to distinguish it from the next guy, psoriatic arthritis, which has this bony proliferation here and here, which is the so-called mouse ears. So bony proliferation. Remember, psoriatic arthritis is one of these seronegative arthropathies. Can you name me the seronegative arthropathies? There are four. So these are the psoriasis, angstbahn, enteropathic, or the one that's associated with inflammatory bowel disease, and Reiter's, or reactive, if you don't want to call it Reiter's, because Reiter was a Nazi. All right, so again, comparative degenerative change here. The arrows are signifying the direction where you're having joint space loss. So if you're seeing it sort of up and then this way, this is a so-called osteoarthritis pattern. Axial, which is straight in, sparing here, which is more typical. That's what you see with rheumatoid arthritis. So axial for rheumatoid. It's just the one that's different. So now we've got two x-rays. This is the same patient, one with a Norgard view. So you may remember the Norgard view is the ball catcher view. That's the one where the all state is in your hands kind of thing. The hands are turned upside down so that the thumb is facing out. So if you look at your hand, turn your hand palm up. Notice that your thumb is facing out. Now turn your hand back over, lay it flat on the table. You notice your thumb is facing in. So that's the distinction between these two views here. Now also, and this is the point, notice that we've got ulnar-sided deviation of these fingers here that reverses when the hand is flat. So these fingers are lax and they're moving out, but when you lay them flat, gravity sort of smashes them flat. People will say that's reversible ulnar deviation, and it's really the only thing that does it like this. The so-called reversible ulnar deviation is lupus. Yes, there's also a thing called Charcot's arthropathy. Well, what the hell is that? It's like a post-viral arthropathy, so post-traumatic fever. You think about Charcot's arthropathy. It's unlikely that that would show up, but it is a thing that's the other thing that can do this. If you're shown reversible ulnar deviation, the answer is lupus, 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 and lupus in that order. And then fifth, I would pick Charcot's arthropathy. That won't be a choice. All right. Next one. Next case. So we've got an absolutely demolished shoulder. So anytime you see any kind of destruction this bad, it almost looks like a surgeon went in there. Surgical amputation, right? Doesn't that look like a surgeon amputated that? It's another buzzword. So neuropathic joints, you can be shown them in an uncommon location, like an elbow. It doesn't have to be a shoulder. Any kind of absolute destruction, and you can't put your finger on it, you should be thinking about neuropathic joints. If you're asked for a next step situation, this would be a bad elbow. Remember, it can be sneaky, it can be shown anywhere. And if you're asked for a next step, you want to get like a spine MR or a brain MR or something. You want to look for the syrinx. So, see that right there. So, why is he neuropathic? Because his spine is all jacked up. He's a C person. He's a C person. All right. Next case. All right. You may or may not be able to see these SI joints, so we'll zoom in here, take a look. So what we've got here is sclerosis and a little bit of erosive change along the SI joints. So when you're shown an SI joint case, you need to decide on whether or not it affects both joints or one joint. That's the first question you need to ask yourself. If you're saying that this affects both joints, then you need to ask yourself, is it symmetric or is it asymmetric? Symmetric meaning, do both joints look identical or is one worse than the other? So your bilateral symmetric versus bilateral asymmetric, this is the way that I remember it. The A is the first letter in the alphabet, so that's how I remember that this is on the end. So pair, psoriatic, angstbon, inflammatory bowel disease, and reactive arthritis. So pair A, B, C, D. A is first, so A for asymmetric. That's on the outside. That's one way to remember it. So, because I remember that these go together and these go together, but I had, like, sometimes I mix them up, like which ones are the symmetric, which ones are the asymmetric. A for asymmetric, A is the first letter in alphabet, P is the first letter, so that's asymmetric, and then you remember that these two go together, and then these two go together. That's one way to do it. Another way to do it is, notice that A and I are symmetric letters, so if you draw a line down the middle, that side looks like that side, and if you draw a line down the middle of this, that side looks like that side, so they're symmetric. That it's not the case with a P or an R, right? They're different. They're asymmetric. If you draw a line down the middle of that, or you draw a line down the middle of that, they're different on each side. So these are the asymmetric letters. These are the symmetric letters, or A comes first, A for asymmetric. Now, the first thing that I said is it unilateral? Is it bilateral? That was when it was bilateral. So what if it's unilateral? You should be thinking about one thing only, and that is unilateral sacroiliitis equals infection. Infection in the SI joint equals IV drug user. IV drug user equals Pseudomonas for some reason. So that's the way to think about it. Remember, asymmetric SI joint, that's infected. It's infected, it's infected, it's infected. All right, what about this guy right here? This is a classic way to show an entity. Notice that there's erosion of the ulnar styloid. Okay, that is a classic finding. Another finding that's along the same lines is sort of the sister finding, same thing. Erosive change at the end of the fifth metatarsal head. So backing up. Here, see that guy? First thing, everything else looks okay, but you see that? So this is a classic RA. This is the classic ways to show RA. So ulnar styloid and fifth metatarsal erosion in the setting of nothing else. This is an Aunt Minnie for RA. All right, so what about this? We'll take a zoom in here. Ah, yes. Notice this. It's like eroded, right? So it's like scalloping. Also, check that out. Boom. Erosion there too. So distal erosion and then like scalloping. And other places can be shown. Same deal. It's like under a rib. Could show it like under a rib. Same thing like that. We've got a stent here. Under a rib, you can have that kind of stuff. So resorption or thinning of the cortical bone, widening of joint spaces, classically shown under the clavicle. This is renal osteodystrophy. Other ways this can be shown is, see that? See how it's like narrowing here? This one's already done it. It's gotten itself pinned. Another way this can be shown is, so yeah, there we go, boom. This right here, these are all renal osteodystrophy cases. This, like massively widened SI joints. See that? How's it see? That's sort of in shoot up there, right? Pubic symphysis, same deal. See that? Look at that. How about this right here? Some people will call this a Rudger Jersey spine. Sort of a white, black, white, white, black, white. Are you paying attention? Do you see it? Do you see it? Look at these little baby kidneys, right? Little guys. This is a double whammy case, so that makes it even more obvious. Dense bones, this looking thing here. The salt and pepper skull, supposed salt and pepper skull. See how that looks thickened and it's just weird looking. This person's got dreadlocks, right? Maybe. All right. Okay, next case. So what I'm trying to show here are these things. Some people will call these hooked osteophytes. So they can be shown with two things. So what joint was this? Metacarpal phalangeal joint. What did I say affected this joint in our targeted multiple choice strategy? cppd, right? So the other weird thing that can occur there is hemochromatosis, and that's when supposedly all four of them are affected. This is a bunch of baloney, by the way. But for multiple choice, all four for heme. How do you remember that? 1, 2, 3, 4. 2, 3, 4. 4 points on the H, all four. And then the other one is the other one, cppd. Remember, there are two P's just for two. All right, next case. It's a good one. Notice that there's got ankylosis here. We got ankylosis here. We got ankylosis here. So there's when you see ankylosis in the hand, you need to think about two things: erosive OA and psoriasis. Now, mercifully, they're giving us this so-called pencil in a cup deformity, which is like even first-year residents know is like an Aunt Minnie, boom, 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 for psoriasis. But if you were seeing gull wings and you were seeing ankylosis, It's probably ankylosis here too. Then that's the other thing to think about. So ankylosis plus the so-called pencil in a cup. This is the pencil, and then this is the, well, that's the cup, whatever. The pencil, just pencil. Think pencil. Here are the other ways to show it. Remember this like erosive change, symmetric joint space narrowing with fluffy periosteal proliferative bone stuff. These bulky lateral, this is a frontal view, okay? These lateral bridging osteophytes that are like the big honking osteophyte that sort of comes out like this. That you see it better on the lateral view, I'm sorry, the frontal. This is a frontal view. I don't know if I said that. Getting punchy. Frontal view, and you don't really see it on the lateral view, and then they show the frontal view, and it's this big honking lateral bridging osteophyte. That's also a classic way to show psoriatic arthritis. All right, here we go. This is an Aunt Minnie. Boom time. Step 1, multiple choice. Okay, these discs, see that? These dense discs. Multi-level disc calcification. Oh yeah. Ochronosis, right? So some stupid biochemical pathway used to ask this stuff in biochemistry class, and yeah, it's an Aunt Minnie. It's the only thing that does this with the discs. It'd be shown on a lateral view of the spine. All right, so that's it. The next talk is going to be a talk on what I call nodules, which is basically bone lesions.